That's fine.
There you go.
Hello.
Hello, my name's Matt. I'm going to be your nurse today, and I'm going to be interviewing you about your history and family history. And we'll actually go over the physical assessment a little bit later on. Right now, it's just more the history aspect of it. I'm going to wash my hands, and then we'll get right to it. So. Alright, so could you tell me your name?
It's Naaman Looper.
Alright, and your address?
It's at 2600 Abbott Road. It's in Midland, Michigan.
Alright, your birthday?
February 24th, 1986.
Alright, and your birthplace, were you born in Midland?
Yes.
Alright, and your age?
31.
Alright, and gender?
Yep.
Male? Alright, yeah, and then are you married?
Yes.
Alright, and occupation, what do you do for work?
I'm a nursing care associate at
Alright.
a nursing home overnight, and then nursing student as well.
Oh, that's good. And Caucasian?
Yes.
Alright. Alright, so you're, what brings you in today?
Just to get a general health checkup.
Alright. You have any present allergies, health issues right now?
Not really. Just occasional allergies.
Alright, seasonal?
Yeah. Yep.
Alright. Do you take anything for that?
Sometimes like Zyrtec.
Alright.
Just usually only when it gets bad. I usually don't need it.
Alright. Could you describe to me your general health?
I think pretty good for the most part. Just besides the allergies,
Alright.
I get sick occasionally, maybe 2-3 times a year, but
Alright.
sinus infections, but not too much.
Alright. Have you had any like childhood illnesses?
I had somewhat like exercise-induced asthma. Other than that,
Alright.
not really.
Alright. Any accidents or injuries?
A few broken bones.
Alright. Where were those?
Right arm and then left collarbone.
Alright. Any serious or chronic illnesses?
Not really.
Alright. Any hospitalizations?
Just from wisdom tooth surgery.
Alright. And was that in Midland?
Yeah, Midland too.
Alright. Any operations you've had?
Not really. No.
Alright. That's good. Alright. Immunizations, since you're in nursing school, all your immunizations are probably up to date, right?
Yeah, as far as I know. Yeah.
Alright. When was your last exam?
Probably 3 months ago.
Alright. And then allergies specific to pollen, cats, dogs?
Dust mites.
Alright.
And I think somewhat to cats.
Alright. And then what is the reaction like?
Just kind of get runny nose.
Alright.
Could be a sneeze.
Alright.
A little worse with dust though.
Alright.
Dust is my main issue with that.
Alright. And then are you on any medications right now?
Just let's see, just the Zyrtec.
Alright.
And I have a multivitamin
Alright.
as well.
Alright. Now I'm going to talk about your family history, so parents, grandparents,
Okay.
uncles,
Yeah.
stuff like that. Is there any history of heart disease in your family?
Heart disease on my mom's side, yes.
Alright. High blood pressure?
I think a little bit, yeah, on my mom's side as well.
Alright. Any strokes?
Not that I know
Alright. Diabetes?
of. I think one of my uncles on my dad's side had diabetes.
Alright. Any blood disorders?
Not that I'm aware of.
Alright. Any breast or ovarian cancer?
I believe so.
Alright. Any other type of cancer?
Let's see. I think my uncle had liver cancer
Alright.
as well.
Any sickle cell?
No.
Alright. Arthritis?
I think my grandparents probably, but
Alright.
not sure exactly.
Any allergies or asthma?
Just my siblings had some allergies as well.
Alright. Any obesity?
No.
alcoholism or drug addiction?
Not really.
Any mental illness?
My mom has bipolar.
All right. Any suicide?
No.
All right. Any seizure disorders in the family?
Not that I know of.
All right. Any kidney disease?
Nope, I don't think so.
All right. And any tuberculosis?
No, I'm not sure. I don't think so though.
All right. All right. So now I'm just gonna go over different body systems, and we're just gonna see if there's any issues and stuff like that. So as of right now, for your general overall health state, have you been maintaining the same weight?
Yeah, give or take like 5 pounds,
All right.
pretty much.
All right.
Yeah.
Any weakness or anything like that?
Not really in that.
All right.
My back gets sore sometimes though.
All right. Any other general health concerns that you may have, or any differences?
Not that I can think of right now.
All right. Your skin, have you ever had a history of like eczema, psoriasis?
Not really that, no.
All right. Any moles that move?
I have a few moles on my back that are.
All right.
Keep an eye on right now.
Yeah. All right. Your hair, have you? It doesn't look like you've had any balding or recent hair loss.
Not too much to my knowledge, no.
All right. And no change in texture.
Not really.
All right. Do you ever get headaches?
Occasionally, yeah.
Occasionally. All right. Do you take any medication for that?
Maybe Tylenol,
All right.
something like that.
All right. Have you ever had any head injuries?
No.
All right. Vision. Do you wear glasses? Do you have to wear them? Or?
Yeah, since I was about 5.
All right.
Two.
All right. Well, that's good that you're wearing them. For your ears, have you ever had any hearing loss?
Not really, no. Maybe slightly. I play drums, so.
Oh, all right.
A little bit.
Do you wear earplugs or anything when you play them?
No, I should, but I haven't really.
All right.
Nope.
All right. Any infections or any discharge in your ears?
I have a ear infection. That was probably when I was 10 years old.
All right. And then for your nose and sinuses, you said occasionally you get sinus infections.
Yeah.
Do you do anything for those medication-wise, or?
I'll take like sinus, like flu and cold medicine,
All right.
or like the sinus rinse. I'll do that.
Oh yeah.
Yep. Yep.
Any mouth or throat issues?
Not really.
All right. Go to the dentist regularly, or?
Yeah.
All
Try
right.
to.
All right. Have you ever had any problems with your neck?
Just kind of sore sometimes.
All right.
But sometimes studying a long time or something.
Oh yeah, if you sleep on it wrong, or if you're
Yeah.
in one position too long.
Yep.
And then do you ever, even though you're a guy, breast exams? Do you ever do that?
I know it's important to keep up on that. Kind
Yeah.
of feel for lumps
Yeah.
or anything.
Yeah. So you know it's a little different for us guys, but you still wanna just if you feel anything that just doesn't feel right or is out of the norm, it doesn't hurt to call, doesn't
Okay.
hurt to come in, and maybe once a month, if you just check, what can it hurt,
Yeah, why not?
it takes a minute, 2 minutes,
I'm not opposed to it.
Yeah. For respiratory, have you ever had any problems with your lungs, breathing, shortness of breath, hard to breathe?
Not really, no.
All right. Have you ever had a chest X-ray?
Not to my knowledge.
All right. With your heart, have you ever had any heart problems, murmurs, anything like that?
Not that I'm aware of, no.
All right. Have you ever had a ECG?
Can't think of that, no.
All right. Have you ever had any like coldness, numbness, or tingling in your fingers or toes?
Not really, no.
All right. Can I see your hands? Yeah, they're pretty much they're the same temperature as the rest of your body. Yeah, if you ever have where you're, it says since normally they're the same temperature. If they ever get
Yeah.
cold for a little while, maybe just something to check up on. Do you at your job you're at the nursing home, so you're probably not sitting too much for a long period of
Sometimes,
time?
no, not for a very long time, no.
All right. Is there any foods that you have trouble with eating, you
I don't like onions, but I don't think there are any
Alright.
problems with them.
Alright, have you ever had any heartburn?
Yes, yes.
Alright, is that due to spicy food or?
Mm, yeah, I think usually if I eat something like with a lot of tomato sauce or something,
Alright.
greasy or something.
Alright, do you take anything for that?
Take like Tums or something.
Alright. Have you ever with your have you ever had trouble peeing? Do you how frequently do you go?
Probably 3 times or
Alright.
4 times a day. Depends.
Alright, and
Take a lot of water.
yeah, you never have any problems where you have to wake up in the middle of the night to go pee or?
Occasionally, yeah.
Occasionally, alright. Do you know what the color is?
Usually pretty faint yellow.
Alright.
Clearish.
Alright, any urinary tract infections?
Not to my knowledge, no.
Alright. Alright. Do you perform testicular self-exams?
Yeah, no, it's good to do that. Try to keep up on that when I can think of it.
Alright, and then do you do that once a month?
Yes.
Alright, and then where do you do that?
Just usually in the shower or after the shower,
Alright.
so when I
Alright.
think of it.
Alright, that's good.
Mm.
Alright, and then you said you're married for your sexual health. Is everything going good there?
It's pretty good.
Satisfactory?
Yeah.
Alright, do you guys use contraception or?
We had, but my wife's actually pregnant at the moment,
Oh,
so.
so you didn't?
Not most recently.
Yeah, alright, any history of STIs?
Nope, not really.
Alright, and your wife is the only partner you have right now?
At the moment, yes.
Alright, alright, have you ever had, like, now we're moving on to like your muscles and stuff, have you ever had any stiffness, pain, muscle cramps,
Slightly. Some
Alright.
stiffness in my legs sometimes.
alright, that's due to,
Usually if I'm not as active, if I'm like
Alright.
sitting for too long a period of time.
alright, do you walk a lot during the day?
Yeah, I try to, usually.
Alright, or exercise?
I don't exercise as much as I probably could.
Alright, have you ever had a history of seizures, strokes, fainting?
Not that I remember, but no. No.
Yeah, any blackouts?
Only when I was on a roller coaster that I remember, but other than that, no.
Alright.
No.
Alright, so, your mental state is good? you
As far as I
think?
know, I hope so, yeah.
Alright,
Yeah.
no nervousness, any like big mood changes?
Not really, no.
Yeah, alright, everyone has mood changes,
Sometimes, yeah, but no.
But a lot of
Yeah.
that is just life related.
Yeah.
Alright, have you ever, if you get cut or anything like that, do you usually bleed for a while before it clots up?
Usually,
Or-
it doesn't take very long.
Alright,
But,
alright. That's
fortunately,
good.
haven't had too many horrible traumas or anything, so.
Yeah, do you notice that you have excessive bruising?
Not really, no.
Alright, alright, any lymph nodes that swell up, they notice, and we'll get more to that later in the
Okay.
physical assessment, but have you noticed any?
Haven't noticed anything, no.
Alright, any history of diabetes?
Nope.
Alright, any excessive pain where it just seems like you just keep going and going and going?
Only days if I'm like exercising and drinking
Alright,
just a ton of water, but not other than that, really.
alright. Alright, well that covers it up for the body systems.
Okay.
Now we're gonna talk about education activities that you do and
Okay.
stuff like that. So, what was the last grade you completed for
Um,
education-wise?
Just my last 2 years of doing college.
Alright, so you're in progress to get
Yeah.
your bachelor's?
Yeah, I got
Alright.
2 more years on my bachelor's to go.
Alright, and then, obviously you're working, like you said, is your financial status, is that, are you doing good there, or?
Pretty good at the moment, trying to
Alright.
keep, I like to save more, but staying above water for the moment, yeah.
Mm-hmm. Do you have a value belief system?
Yeah.
Alright,
As far as like a religion or?
yeah, do you like go to church, or?
Yeah, I'm a Jehovah's Witness.
Alright.
I do that, so we just go twice a week to
Alright.
church.
Alright, that's good. And then we went into a little bit of it of activity and exercise, but how
Yeah.
typically what's your usual pattern?
Let's see. As far as exercise?
Yeah.
More like, I'd like to do once a week, but it doesn't always happen.
All right.
Yeah.
All right. Yeah. They say you should at least strive towards 150 minutes a week of
Yeah.
exercise, but you're working, you're going to school,
Mhm.
probably both full time or at least one full time and one part time,
Yeah.
and that can it can kind of
But I guess part of that done with.
Yeah,
A little bit
yeah.
of exercise there.
Yeah, so sometimes it's hard.
Mhm.
With all your activities that you do every day or people do every day, such as feeding, bathing, hygiene,
Yeah.
dressing, you can do those all by yourself?
Yeah.
Or?
Mhm.
All right,
Yeah.
that's good. What do you do for leisure? You said you play the drums.
Mhm. Sometimes I play, like in the summer, disc golf I play,
All right,
and like snowboarding in winter.
all right,
Mhm.
that's good.
So, main ones.
All right, your sleep, how much sleep do you get on a night on average?
I like to get more like 7 or 8, but it doesn't always happen. Like
Alright.
5 to 7 probably.
All right, that's good. And then once you have the kid, it's probably
Yeah.
gonna drop down
Yeah.
even more.
Yep.
Can you recall your diet in the past 24 hours?
Yeah. Let's see here. I had cereal for breakfast, and then like a chicken sandwich for lunch.
All right,
And let's see, for dinner I had like some pasta,
all right,
like ravioli.
all right,
So and a few snacks in between, but
all right.
so I can think of right now.
All right, and then is that menu typically what you have?
It's more regular, but it's kind of, it can change from time to time too.
All right. And then who buys your food?
Either my wife or myself.
All right, and then who prepares it?
It kind of depends too.
Alright.
I cook and she cooks sometimes, so kind of
All right.
half and half.
And then do you feel your finances are adequate for your food?
Yeah, yeah.
All right. And then who's present at meal times?
Usually just my wife and myself, and
Alright.
sometimes my family.
All right.
Got a couple of my few sisters and my niece.
All
Stuff
right. All right. Could you describe your role in your family?
Yeah, just I guess husband, I guess co provider, I guess.